Peripatetic Educators Unplugged, the re-emergence of peripatetic educators in primary care. Welcome listeners, you're tuned in to Peripatetic Educators Unplugged. I'm Gemma Hodge and joining me, my co-host today is Dr. Debbie Cross. Today we will dive into the fascinating world of peripatetic educators in primary care. So Debbie, peripatetic nursing roles, what's the deal?
Well, Gemma, these roles are ever changing, they are, and they are a great need to the workforce. But the thing is, first, I think what we have to do is just break it down a little bit. And so look at what exactly is a peripatetic educator.
Great question, Debbie. Picture this, a role that emerged to address the shortage of practice assessors, especially in primary care. And thanks to funding from NHS England, they're making waves across the Humber and North Yorkshire regions. But how? Stay with us.
Well, thinking about the methods of it all, when we came to do this sort of piece of research, we had to unravel that magic about peripatetic educators. So what did we do? We decided to turn to our reflections, to have a look about what the experiences that we had that actually gave some good validity about our roles. And that was really interesting that we did. But one thing that we really was key to this is that we found that these educators really do bridge student nurses, supervisors and assessors within the primary care networks. They do. They're the glue. However, what's the secret about them? So let's just find out a little bit more about that.
Brace yourselves, folks. The introduction of peripatetic educators in primary care is a game changer. They're like the Swiss army knives of nursing education. How, you might ask?
Well, Gemma, so there's quite a few things, but the key things that we did actually find from this is that the fact is they enhance skill acquisition, they do. They're also brilliant in doing nurse-led clinics, particularly for the students as well, to develop them further. They also tackle the QOFs, or the Quality and Outcomes Frameworks, but there is a little bit more. The main thing about this is that they do expand placement capacity and they ensure proficiency of assessments, they do, and they work like clockwork, they do. So it's like having an extended arm, it is. It really is, and it makes it much more efficient and effective to have those roles in place in primary care.
So, here's the scoop. Peripatetic educators are the glue that binds primary care networks and universities. They maintain consistency and proficiency in clinical placement learning. And guess what? Student benefits too. Their learning experience gets a turbo boost. It's a win-win-win situation, my friends.
Absolutely. So thank you everybody for tuning in. Remember, peripatetic educators are unsung heroes, they are, but they are behind the quality clinical placements. So until next time, this is Gemma. And I am Debbie, and we're signing off as a Peripatetic Educators Unplugged. But watch out for our paper.
See you soon.